This presentation describes how the Stroke Rehab app will help track the progress of the stroke survivor's rehabilitation journey. This issue of recovery tracking is very important for stroke survivors because the current way our recovery information is managed can be summed up in two words: hopeless and archaic. So this presentation presents a 21st century approach to the management of information about a stroke survivor's recovery journey in a way that benefits many of the key stakeholders in the stroke rehabilitation industry, including stroke survivors, their carers and family members, their therapists and medical professionals, hospitals and community health administrators, health educators, and medical researchers. But before we look at the way the Stroke Rehab app tackles this information management problem, it is worthwhile to see what the National e-Health Strategy states about information management in the community sector. In December 2008, the Australian Health Ministers' Conference released a National e-Health Strategy. In Section 2.1 of that strategy, the vision for e-health in Australia was expressed in terms of what it might mean for three key stakeholder groups, namely consumers, care providers, and healthcare managers. But that strategy also summarises the current situation for these key stakeholder groups in the following way. For consumers, the strategy states that they are largely responsible for coordinating their own healthcare delivery. They have to act as integrators of healthcare information across the health system. They spend time repeating the same information to multiple care providers. They receive duplicate treatments. They have poor access or no access to personal health information which is stored in multiple fragmented silos across the health system. There is limited security of personal health information or ability to control who accesses it. Consumers are heavily reliant on individual care providers for access to reliable health information, and they have unequal access to healthcare services, particularly in remote and rural communities. Speaking as a stroke survivor myself, who has spent many years working in the IT industry, I can only strongly agree with these points. And I can say with great confidence that the current situation for consumers of community care services is entirely unsatisfactory. Furthermore, it cannot be patched up using 20th century technology and information management processes. It can only be fixed by radical changes to the way information is collected, organised and distributed amongst all key stakeholders in the stroke rehabilitation industry. But to get back to the e-health strategy, it also states that community care providers work with incomplete and fragmented client information when providing care to consumers. They also waste time collecting client information and waste effort by duplicating treatment activities. They manually coordinate care with other providers. They exchange information with other care providers in an inefficient, incomplete and ad hoc manner. They risk adverse outcomes through incomplete information and a lack of access to decision support tools at the point of care. They have limited ability to interact with consumers remotely, and they have limited ability to monitor the effectiveness of service delivery outcomes. The e-health strategy also states that community healthcare managers rely on incomplete, fragmented and untimely information when trying to make decisions. They waste time trying to collect and manually integrate information from many different sources. They have limited ability to share clinical and administrative management information across health sectors, and they find it very difficult to meaningfully understand the national impact of strategic, operational or clinical treatment decisions. It can be concluded from all this that the management of information about stroke survivors' recovery journeys is extremely fragmented across many computer databases and paper-based records management systems, which cannot be properly indexed or cross-referenced, is incomplete, out of date, and hence inconsistent and error-prone because updated consumer health information does not get propagated throughout all relevant databases, is constrained by inefficient information flows that are inhibited by technology incompatibilities, obstructive privacy laws, and data ownership issues, is useless for stroke survivors and carers, and is of limited value to community care service providers, and is useless for the planning of community care provision. On the other hand, the Stroke Rehab app has been specifically designed to address some of these gaping deficiencies by consolidating stroke recovery, service availability and service delivery information in one central database, by streamlining information flows between key stakeholders based on their need to know, and coordinating all those information flows through that central database via the internet, and by providing reliable service usage and planning information by organising all stroke recovery and service delivery information around a common definition of disabilities provided by the ICF framework. The ability to continually assess a stroke survivor's recovery progress is essential because there is a need to establish a disability baseline as the stroke survivor is discharged from hospital and commences the community care stage of their stroke recovery journey. A need to track changes in survivors' perceptions of his or her disabilities, because one disability might be of major concern immediately after discharge from hospital, but over time the survivor learns appropriate coping strategies which lessen that level of concern, and concern about other disabilities become far more significant. There is a need to modify community care plans to reflect changes in the level of concern about his or her disabilities. There is a need to understand the psychological consequences of various disabilities, because negative moods caused by particular disabilities can seriously inhibit the overall stroke recovery process. There is a need for evidence of availability and effectiveness of services and programs in rural and regional communities, so health system educators, planners and administrators can have access to consistent, accurate and timely information to act together to improve the community care system throughout Australia. So what sort of stroke recovery information needs to be collected? And how will it be collected? Well, it is proposed that we need a specially designed stroke quality of life survey that provides a standardised method for collecting reliable and up-to-date stroke recovery information that is based on the activity and participation section of the ICF framework, and that helps therapists focus on issues of greatest concern to their clients through the entire community care stage of their stroke recovery journeys. In part 1 of this presentation on tracking the stroke recovery journey, I have argued that the management of healthcare information in the community sector is grossly inefficient and ineffective, and entirely inconsistent with the National e-Health Strategy approved at the Australian Health Ministers' Conference. That this has serious impacts on consumers, including stroke survivors and carers, care providers and community health care managers. That the Stroke Rehab app has been specifically designed to address these problems for stroke survivors, care providers and community healthcare planners. That the ability to collect reliable information about stroke survivors' recovery journeys is essential to addressing the information management problems of stroke survivors, care providers and community healthcare planners, and that there is a need to collect reliable stroke recovery information from stroke survivors using regular stroke quality of life surveys throughout their long stroke recovery journeys. In part 2 of this presentation, I will talk about the design principles of the proposed stroke quality of life survey and discuss the ICF framework on which the Stroke Quality of Life Survey is based.